Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. So today we'll be seeing about communication. So in a healthcare professionals, communication is important. Why? Because we are going to delegate the duties or we are going to give some orders to the other subordinates or superiors, and in that way we have to communicate with them effectively. The communication becomes effective only when the receiver receives the informations or the messages in a proper way and decode it. By after receiving the message, the receiver will interpret the message according to the what the message has been sent. So once he receives the message and work appropriate only, he will give a positive feedback. So once we receive as a sender a positive feedback, then we will come to know that what the communication we have given was effective. If it is going to be a negative feedback, then it will be a cyclic process. So this is a communication. So in all the professions we require a proper communication, and also the person who is going to receive the message should be an effective listener in order to establish the efficient communication. So communication is a two-way process. So there are various types of communications, that is either oral communication or written communication or non-verbal communications. So oral communication is something which we are going to use any words or sentences and we are going to delegate the works, and we'll see one by one what are the communication is. So successful and effective management and leadership depends on well-developed interpersonal skills. Communication is a basic element of human interaction that allows people to establish, maintain and improve the contact with others. The communication skills are needed to develop the interpersonal skills with other personnel. So communication, it aids as a basic element for human interaction. So when we speak with others, there the communication is needed, and that too, that communication should be simple, adequate and appropriate to the situation. So for example, in a miserable situation you cannot go and make some humor sense there. So that is known as a proper communication. So according to the situation and scenario we will communicate. So for example, like delegating the works or assigning some works to the staff nurses, so that and all needs a effective communication. So the communication is being started from the sender to the receiver by through adapting some medium, that is a channel. Either we are going to tell orally or whether we are going to say to the nurses in a written form or non-verbal communication. So next we'll see the definition of communication. So the communication is an enabling process that allows information to be transferred and ideas to be translated into action by the author, sizes or joiner. So according to this author, he says that whatever the information is being transferred, it has to be translated. So it will get transferred only when the receiver receives a proper communication. So according to Keith Davis, the communication is a process of passing information and understanding from one another to another. According to this author, it is a process of passing any informations or messages from one person to another. So next we'll see the purposes of communication. To establish and disseminate the goals. So for example, any healthcare institution have a goal. So always any institution will have a vision statement, mission statement and goals. So once we communicate with the persons who is being newly recruited in the hospitals, we will communicate about the organizational goals and everything. Next, develops plan for their achievement. To achieve something, we have to plan and we have to tell those informations to other staffs. That is being achieved by the proper communication. Organize the human and other resources. Select, develop and appraise a member of the organization. Lead, direct, motivate and create a climate in which people want to contribute. Control performance. For example, if we want to appraise any member or in a particular institution, so once we will decide that that particular member is working very hard for the institution to achieve the organizational goals, so we will communicate with that member regarding his achievement, his interest towards the organization, his task accomplishment, everything. So once we want to convey any messages, there requires a communication. So communication means sharing sharing of informations from one person to another person, and also to motivate others, in order to direct others, in order to follow some commands, or in order to delegate the works to the staff nurses, we require a communication process. So next we will be seeing about the communication process. So in communication process, it consists of sender and receiver. The sender who send a message or information, that process is known as encoding. So by adapting some of the medium, so this message is being sent to the receiver will decode the message from the sender. Then if he completes the task, and if the receiver understand whatever the sender sent, then the process will take place as a positive feedback. If the receiver is not able to understand the information, or maybe some of the disturbances in the channel, that will go as a negative feedback. So sometimes when a sender sends the message to the receiver, he uses a medium, that means any channel, either through email or written or oral communication. That channel, if it is being disturbed by any other external variables like noise or any physical disturbances or cultural disturbances or the gender disturbances, there what happens is the communication gets disturbed. So what happens, this message being sent by the sender will not be properly communicated or interpreted by the receiver. Then the receiver gets confused and he will not able to complete the task properly. There what happens, the receiver will give a negative feedback to the sender. Then sender what will do is, he will rectify the mistakes. If he thinks that channel is a problem or the message what is sent is a problem, then he will rectify the mistakes. Then what he will do is, he will adopt the new method of medium of channels, other channels which was previously used. Then he will again send the message to the receiver. Then what happens, again the encoding of message takes place, then decoding, then feedback. Then this process is a cyclic process. So next is, we will see about it in detail. So sender is one who conveys the message to other person. The message is something that is a thought, idea or emotion, it is being conveyed. So encoding means conversion of the subject matter into symbols, and channel is a medium used to transmit the messages. So these channels can be whether what type of channels, maybe teleconferencing or oral or written. So receiver is a person to whom the message is meant. And decoding is a process by which the receiver converts the symbols received from the communicator to drive the meaning of message. So feedback, the receiver's response to the sender. So whether it is negative or positive, depending on the message conveyed. So next is importance of communication. So why we require the communication? So basis for planning and decision making. So when we are just making any decisions or any planning, if it has to be conveyed to other personnel, they requires the communication. Next is facilitate the smooth working, increase the managerial efficiency, facilitates control, basis for leadership, motivation and morale. For example, any staff nurse or any healthcare personnel is working very hard and he is just oriented to the organizational goals, then we will give them motivation and morale. And how we will give this motivation? By communication, like calling the persons and telling that you are doing very good, your efficiency of work is very good. So that is being achieved by the effective communication. And next is increasing the human relation. So human relation in the sense, when we communicate properly about the healthcare organizations, then the patients will get attracted to the hospitals. So we used to say, no, that sister had said me everything, whatever the questions I had, she clarified me. So if the communication was effective, only that patient will tell like this. So we have to encourage the effective communication to the personals. Next is functions of communications means it controls the member behavior, provide release of emotional experience, provide information needed to make the decisions, and also giving training and development. For giving training and development for both the workers and executives, for example giving orientation or training, the communication is very much important. Next is for coordination purpose, to have a when we just speak about the healthcare personals, it is like a collaborative approach while caring the patients. So there also we require a proper communication with the other healthcare personals and give a comprehensive nursing care. Next is public relations. So whatever we are doing, it is for the interest of society, and there also requires a communication. Next is characteristics of communication. So communication is a persuasive function. It is required to functions of management, and organization involves transfer of information about any particular task, authority and responsibility. For example, I am the head nurse of a particular intensive care unit. Then what happens is I will delegate the works to the staff nurses. So while I delegate the works to staff nurses, I will use the communication. I will delegate the work by giving the orders. So that is the characteristics of communication. Next is communication is a continuous process. So we will have a continuous, then only what happens, there will be a continuity of care also will be there. Next is, it's a basic purpose of communication is to create the mutual understanding and cooperative human relationship. So once we establish a effective communication only, what happens, the receiver as well as the sender will have a mutual understanding that I have given some messages, that messages is being interpreted by the, that is, and after analyzing, the receiver will interpret the message, and according to the message he or she will react to it. So for example, I am delegating the work to a particular staff. That staff will receive the information from me. For example, I am going to tell the staff to check the narcotics. Then he or she will do that work by getting the message from the head nurse. That is known as proper communication. So that is the characteristics of communication. That means transfer of information about the task, authority and responsibility, and the communication should always be a continuous process. If there is a discontinuity, the continuity of the communication will not be there. For example, I am telling one order of the work to a particular staff today, and later on after 5 days if I am telling, means there will be no any continuous. So always the communication is continuous process. Next is communication channel. Through what all channel we can communicate to the other person is like telephonic conversation, by face-to-face interaction, by meeting, formal reports, that is written communication, face-to-face interaction, calling the person and telling the order to them, then teleconferencing. So by sitting from other part of the other corner of the hospital, we can just give the guidance to the persons who is on the opposite side pole of the hospital. That is known as teleconferencing. Next is electronic mail. So nowadays what happens, whatever we are doing, you should have evidence. So when we are just giving a written communication or a communication through email, it is being served as a evidence. So these all are some of the channels. We just use it to convey the message from the sender, and it is being received by the receiver, like telephonic reports are being given. For example, if we want to administer any medication, we will call the doctor and get the oral report. Then we will continue our nursing care, and also by meetings and face-to-face and teleconferencing. So next is principles of communication. So communication should be conviction. It should be appropriate to situation. So whenever the humor is required, we will do the humor sense. Whenever a strict order is required, we have to go in that way. So appropriate to the situation, we have to convey the message. That is for the proper communication. Next is the communication should have objective and purposes. So whatever we are giving the informations or messages, it should have some objective, and it should have some purpose. So without purpose, if we will not communicate at all. So that is something different. For the professional organization, we should have a purpose and objective. The communication should promote the total achievement of purpose. So for what purpose we are communicating, it should be achievable. So communication should represent the personality and individuality of the communication. So whatever we are giving the communication to any personnel, he should represent that personality and individuality. So these all are the principles of communication. So other principles like it should be simple, adequate, appropriate to situation, understandable language. So for example, if a person doesn't know any regional languages related to Tamil or Telugu, you cannot go and tell the person who doesn't know that language, if you tell that information in that particular language, he or she will not understand. So we have to communicate accordingly. Next is it involves a special preparation. It should be oriented to the interest and needs of the receiver. Communication through personal contact. Communication should seek attention. So whatever we are communicating, the receiver should seek the attention. If the receiver is not having any attention or concentration, what happens? The communication will not be properly interpreted. And it should be familiar. For example, in all the professional organizations, if you are communicating with some purpose and objectives, and it should be familiar to that particular person. For example, I am going to delegate the work to any staff nurse or any healthcare personnel who is not at all having experience on that particular topic. It is difficult for them to interpret it. So according to the familiarity, you have to communicate. Next is strategies of communication is to think before you speak. So before speaking or communicating, you have to think twice and thrice, and then only you have to speak. Then active listening. Next, questioning. For example, as a head nurse, I am going to tell my other staff nurses to check the crash cart or to check the medications. If that a particular staff is asking me any questions related to the work I have been assigned, so I should be very much ready to tell the answer to whatever the questions they are raising it. Next is using discretion. So if you are just ordering in a monotonous manner, it is very difficult for them to understand, and also it is difficult for them to interpret and act accordingly. So you have to use the pause wherever it is required, and when increase of pitch is needed, increase of volume or decrease of volume according to the situation. So next is forms of communication. That is the communication on the basis of channel. It is formal and informal communication. On the basis of direction, it is upward communication, downward communication, or horizontal communication, otherwise known as lateral communication. On the basis of expression, it is verbal and non-verbal communication. So direction of communication, the downward communication means the manager to staff, from the upper to lower the communication takes place, usually directive. That is, you are as a manager, he will direct you to work. Next is upward communication, that is from the lower level to higher level, usually involves reporting of informations or problem solving. So lateral communication means between the same department level we will communicate. That means between the two staff nurses, if you are communicating, that is known as lateral communication. So diagonal communication between, that is the communication between two different departments. If they are communicating, that is known as diagonal communication. That is the two different departments will communicate. For example, the nursing personnels and the physiotherapists are communicating, means that is the example of diagonal communication. So lateral communication between the two staffs nurses, it is the lateral communication. So upward communication between the staff nurses to head nurse or nursing superintendent. So downward communication means from the nursing superintendent to the staff nurses. So on the basis of method of expression, the verbal communication. So verbal communication means using of any words, phrases or sentences to communicate the messages. Next is non-verbal communication, means using of gestures, facial expressions, posture and gait, tone of voice, touch, eye contact and physical appearances. For example, body languages, facial expressions and the tone of voice and also posture. So these all also will give you some signs of communication. That is known as non-verbal communication. So in verbal communication, again it is been classified into oral communication and written communication. So communication is done by mouth, word of mouth and a piece of writing. That means it includes both oral and written communication. So first we will see the oral communication. So in oral communication, spoken words are used. It includes face-to-face conversation, speech, video, telephonic conversation, radio, television, voice over the internet. And communication is influenced by the pitch, volume, speed and clarity. So if we are telling any information in a monotonous manner, it is difficult for the receiver to receive the information and interpret, analyze it and act accordingly is being difficult. So the oral communication is being delivered properly only with the proper pitch, volume, speed and clarity. So next is advantage. It brings a quick feedback in a face to face conversation by reading the facial expression and body language. That means when a person is telling you something regarding their situation and you just notice that their body language is not appropriate to what they are telling, so that is the we can easily identify. So in Tamil it is a famous proverb that your mouth is telling the lie but your eyes are telling the truth. So that is a advantage of oral communication. You can easily find out whether he is telling truth or lie. So disadvantages like face to face discussion, user is unable to deeply think about what is being delivering, so that it can be counted as fault. Sometimes these observation can also end up in the false assumption. Maybe it is wrong or right, like that we will have some assumption, no, that is one of the disadvantages of the oral communication. So next we will be seeing about the written communication. So how the written communication is? In written communication, the written signs or symbols are used to communicate. In written communication, message can be transmitted via email, letter, report, and also the written communication being act as a evidence for us. For oral communication, you cannot preserve those oral conversation being taken place, whereas in written communication it serves as a evidence, as a written document. It serves as a legal and ethical evidence for us, and also we can use it in the future references. In future times if we want, means you can use it. So advantages, the written messages enables the receiver to fully understand it and send appropriate feedback. So after analyzing properly and reading, the receiver will send a feedback. So disadvantages, immediate response is not being obtained. So it will take time for the receiver to read and understand, then only the receiver will give the information. So that is the disadvantage of written communication. Next is non-verbal communication. In non-verbal communication, it is a wordless messages that involves gestures, body languages, posture, tone of voice or facial expressions is called the non-verbal communication. So non-verbal communication is all about the body language of the speaker. So how he speaks and how he uses the facial expressions and the body languages and using of some gestures winking, like that all involves the non-verbal communication. And also the non-verbal communication should have some three elements, that is mainly the appearance and body language. So in appearance, the speaker's clothing, hairstyle, neatness, use of cosmetics, surroundings. When we have a proper room size, proper lighting, ventilation and decorations, then only this communication can be easily understood. That is non-verbal. Body language, which involves facial expressions, gestures, like that. Next is levels of communications. In levels of communication, it is intrapersonal communication. That means self-communication, that is talking to themselves. It known as intrapersonal communication. For example, I will be thinking, so for today what dress I have to wear, today what work I have to accomplish, so today what duty I have to do, so what I am going to do in the night time. So that means that is we are talking to ourselves. That is known as interpersonal communication. So this is very important for each and every person. To what they are feeling, they will tell to themselves. That is a intrapersonal communication. And also, for example, when you think about something and when you want to do on the weekend, everything is said in intrapersonal. For example, if a nurse is being assigning the work to the staff nurses, that staff nurse will think like today what I have to do, what all basic need I have to fulfill. That is. Next is interpersonal communication. That means it is a communication between two people but can involve more in informal communications. So examples, when the two friends are talking, or a teacher who is discussing about the assignment in the classes, and also a doctor and the nurses is discussing about the patient's treatment process. the manager and the potential employee during an interview. This all is a interpersonal communication. So next is one to group communication. So from the word itself it is clear. So one person is going to speak with a group of people. That is known as one to group communication. For example, a teacher is teaching in the class. The class members will listen to the teacher. That is known as one to group communication. And the same way, a preacher and a congregation, a speaker and the assembly of a people in the auditorium. So one person will be speaking and other group of people will be listening to the individual person who is speaking. That is known as one to group communication. So next is mass communication. So mass communication means when we are communicating to a very much large number of people. So how we can communicate to these many number of people is by televisions, by newspapers, by magazine articles, by hearing on the radios or books, newspapers, billboards. So these all are the mass communication. To the mass people we are going to communicate to them. For example, giving a recruitment for the advertisements in the newspaper. So what happens? So the mass people will see that advertisement and come for the recruitment process. Next is influences on communication. So age is a major factor in influences. So if for example I am telling any information to the two children, means if the two children's age group is different, so one is schooler and one is infant, so both will interpret the messages in their own way. So age is one of the factor which influences the communication. Next is education, emotion, cultural differences, and language, attention and surroundings. So language means if I am telling in English, if a person who is not able to understand that particular language, means it is difficult for them to interpret what I have said. And in the same way, education, if I am delegating any work to a person who is not at all related to the medical personnel, then what happens? He will not understand the medical terminology. So it is difficult for them to understand those medical terminologies. So education also plays a major role in the communication process. And cultural differences. So each and every culture will have some differences. So when I am telling any order or any delegation of duties, so according to their culture they will think and they will understand the language or information. So cultural also plays a major role on the influences on communications. And also surroundings. So if a surrounding is very noisy and it is not good ventilated, what happens? Whatever we are interpreting, it will be not fully understood by the receiver. So what happens if there is very noise in the message, means the receiver will not interpret the message and he will not give the proper feedback to the sender. So these all are the influences on the communication. If the communication is not being effectively communicated to the based on the age, based on the education, based on the emotional stability of the persons, cultural differences, language barriers, attentions and surroundings. So next is communication technique. So how we can communicate to the person in a very effective and efficient manner. So clarifying and validating. So whatever I am telling the information to the person, I should clarify them. Whatever they are asking any questions, I have to clarify their doubts, and then only the informations what I have sent will be effectively interpreted by the receiver. Next is asking open questions. For example, I have said as a head nurse I have delegated the work to the staff nurse. So staff nurse is asking me, sister, where is the key to open those cupboard and check these stationery items or medications? Then I will tell that the key is placed in the particular cupboard. So we have to, if a person is asking any questions related to the communication, we have to answer it. Next is using indirect statements, reflecting, paraphrasing, summarizing. So whatever we are telling, we have to again summarize whatever the information being conveyed. For example, in case of mass communication and all, we have to educate them, and later on we have to summarize what all communication has been given. Next is focusing. So whatever the information is given, it should be very much focused. Then if we have focus only, what happens? Whatever the information or messages we are sending, it will be effective. Next is silence. So we say silence explains more than words. That means silence speaks more than words. So silence also one of the very effective communication. How? Because for example, a higher authority is telling you to do some work. If you are not interested in doing that work, what you will do, you will stay silent. Neither you will tell yes or no, you will be staying silent. It means that you are protesting that work to not to do. So automatically that higher authority will understand. That means silence means either it is rejecting or sometimes it is accepting. So silence also plays a major effective technique in communicating the individual. And also when we are communicating, sometimes we require a pausation of the communication words, or increase in the pitch, everything is required. So next is barriers of communication. So barriers of communication means, for example, a sender is sending a message and receiver decodes the message. So in between the message, if it is properly interpreted, then it is okay. Sometimes what happens, there will be some disturbances, whether physical disturbances, cultural differences, language differences, a channel is not proper. That are all the barriers of communication. So first one is semantic barriers. That means that the confusion between the sender and the receiver. That means if a sender is not conveying the message in a proper way, in a proper tone, if he is telling very speed, then what happens, whatever the message being conveyed, the receiver will not able to receive that message properly. That is known as semantic barrier. That is misunderstanding of the concept or any information or message of the receiver. If a receiver is not able to understand the message, that comes as a ineffective communication. That particular term is known as semantic barrier. It involves unclarified assumptions, everything. Next is psychological or emotional barrier. For example, I am very sad and I am crying. So someone is coming and telling me to do the work. Will I do that? Will I listen to that information, whatever it is said? No, right? So when we, according to our psychological interest and our emotional stability also, the communication gets affected. So when we are telling any information, no, it depends upon the consciousness, emotions of the receiver. So next is personal barrier. So personal barriers means each and everyone have their own experiences and their own efficiency. So whatever I am giving the information to the receiver, if the receiver properly understands, only what happens, he will do that work, he or she will do the work perfectly. So personal acceptance and experiences, emotions and attitude and behavior also plays a major role in the barriers of communication. If I am not able to understand or accept the communication whatever you have said, then I will not do that work properly. So that is a personal barrier. So next is physical barrier. So physical barrier means that is the difficulties in the channel. If whatever the medium I have used for the communication, no, if the channel is not proper or it is having any disturbances, that is known as physical barrier. Next is perceptual barrier. That means how we perceive the information. So someone is going and giving me some order in doing some particular work. If I am not experienced in that work, what happens, I will not listen to them and I will try to deny that information. So that is a fear of that means having a fear or guilt whether I will complete the task or not, like that. So that is a perceptual barrier. Next is cultural barrier. So our country especially, it is a unity in diversity. We have various cultural differences. So culture also plays a major role in the barriers of communication. So when we are communicating, if it is not being understandable due to the cultural differences, it is very difficult to establish a effective communication. So next is language barrier. So for example, someone is not understanding a particular language. If I am going and explaining them and that language means, what happens, he will not at all understand it. So that is a language barrier. So next is gender barrier. So gender also plays a major role in the barriers of communications. So for example, some of the communications requires only the female persons and sometimes it requires only male persons. So if there is a mingling of both the persons, then it will be very embracing to share any information. So gender barriers also plays a major role in the barriers of communication. And also language barrier. So from the image itself you can see, so someone is telling in other language like Japanese or Spanish, like that. So next is Interpersonal barrier. So interpersonal barrier means how I am going to perceive the information, whether I will be able to accomplish the task, whether that means we are having a guilt. If we are getting some information, if that information is properly understood by me only, what happens? I will complete that particular task, or I will go and assign that work to any other person. If I itself not going to understand, or I am not going to think what information is being given, then how I will be going and interpreting it? That is a interpersonal barrier. So barrier among the sender as well as the barrier among the receiver itself. Next is enhancing the communication. So how and all we can, even after just establishing a proper medium of channels, there are some ways to enhance the communications. How and all we can do is self-disclosure, caring, genuineness in whatever we are sharing the information, warmth, active listening. That is, you have to actively listen first, then only you have to interpret properly. Empathy, that is putting ourselves in others' shoes, so making ourselves to stand on others' place and realize how the person will be feeling it. Next is steps to overcome barrier of communication. So we have seen so many barriers, like physical barrier, cultural barrier, language barrier. These are the ways to overcome from this. That is clarity of information. Whatever we are information being given, it should be very clear. Prompt action. For example, I am complaining about my superior to the management. So the management should see whether the person who is telling about that other person is correct or not. So according to that, the prompt action should be taken. Creating a proper atmosphere. For example, I am conveying the message. If there is a very much noise or loud, so what happens? That message will not be properly communicated. So we have to create a very good environment for the communication process. Focus on the receiver. So according to the receiver, we have to alter the message and tell. For example, if they are having any physiological deformities or emotional deformities, so based on the situation, we have to alter the communication and communication channel. So we have to mainly focus on the receiver. So next is effective channel. So whatever the channels we are opting to give the communication, we have to adapt a effective channel. So for a very large group of people, what channel we will adapt is like mass communication, like television or radios or newspapers. Next is problems in communications is not truly listening. So someone will be like not completely, they will be listening. They will not have attention towards the receiver. The receiver will have a inadequate attention. That is a not truly listening. So assuming you know the message before the person finishes. For example, not the two persons will be talking. So one person before completing, he will say, yeah, I know that information. So that is very ineffective communication. Interrupting the speaker. So in between, if we are interrupting the speaker, what happens? The speaker will get confused, and also the person who is asking the question will also get confused. So once we have to complete every command or order, then only we have to ask the question. Using the you statement instead of I statements. Failing to account for cultural differences in communication. Misinterpreting the message. So whatever the message is being sent, the receiver has to interpret whatever the message has been conveyed to them. If he is having misinterpretation, there also what happens? There comes a problem in communications. Being indirect. So if you want to give any information, you have to give directly. So if you just go a long loop and come, what happens? It will be difficult for them to understand. Avoiding difficult conversation. So according to the age, education, you have to limit your conversations. You should not use any complex words. So for infant and all, you can't go and give very complex words, right? So based on their age, based on their understanding, you will give the communication. So at last, the communication may break down as a result of many communication barriers that may be attributed to the sender or receiver. So far we have discussed about what is communication is, what are the purpose of communication, what are the types of communication, what are the forms and channels of communications, what are the barriers in communications, what are the problems associated with the communication. So communication is an effective tool in order to send the information from the sender to the receiver. Once the receiver interprets the message properly only, he will give a proper positive feedback. If not, he will go with the negative feedback, and that communication will take place, a cyclic process, and if it is not properly understood, it is also a time consuming. So if you have any doubt, kindly drop down in the comment box, or if you want to take me any other topics related to nursing, kindly drop down in the comment box. Kindly like it, share it and subscribe it, and then watch the videos, because many of the persons are watching the videos without subscribing it. So kindly subscribe and watch the videos for the latest updates in the nursing concept and theory. So that's all the topic is. Thank you for watching.